Holly on Fox. It's not surprising that kids get sick from time to time, but what if your child got sick and doctors didn't know what was wrong? A Valley family experienced that firsthand. Their 10-year-old daughter was treated for routine viruses, but it turns out it was something much more serious. It's 5 p.m. on a Wednesday afternoon, and 10-year-old Taylor Culver is feeling fine. And although she looks like a happy, healthy little girl, it wasn't always this way.
I don't know what was wrong. I didn't know anything about doctoring and stuff, so they said that I needed to go to the hospital right away.
Taylor is talking about what she went through last December. Her mom, Kim, says Taylor got frequent headaches. Her lips and nails were even turning blue.
They gave her chest x-ray and they saw a mass on her lung and they said, okay, she has pneumonia. That's what they assumed.
But that assumption was wrong. Taylor's condition was much more serious.
So she went into a different hospital for 7 days. They couldn't figure it out. They released her.
In and out of different hospitals, the Culver family finally came to this one, Phoenix Children's Hospital. This time, doctors knew exactly what was going on.
This is Taylor's chest, and what you're seeing is an abnormal tangle of blood vessels in her left lung.
That large tangle of blood vessels is a rare genetic disorder called HHT, which stands for
hereditary hemorrhagic telangiectasia.
The disorder restricts oxygen flow through the blood vessels and occurs in about 1 in every 10,000 people. Worst of all, it can be deadly if left untreated.
Well, because of her large abnormality in her lung, she was at risk for having an infection in her brain, also having a stroke, and big risk for having bleeding in her lung and in her brain.
What's strange is, although it's a genetic disorder, neither of Taylor's parents carry the gene. Doctors say Taylor had a mutation of it, and it led to abnormalities in her lung and brain. Aside from the headaches and changes in her skin tone, Taylor never displayed any of the typical symptoms.
In Taylor's case, the most common occurrence is a bloody nose. She never had that. So I think it was harder to diagnose for the pediatricians because of that.
But now that she was diagnosed, it was time for treatment. Doctors used plugs to help untangle the blood vessels in her lungs, which got oxygen flowing through her body.
It was an amazing transformation, immediate.
She's now at 100% breathing ability and is running around and great, healthy little girl.
Her mom says they're both thankful and lucky they now have some answers.
The thing is, we didn't realize, she just seemed like a normal, healthy child. So we really didn't realize how severe it was or even what this was.
But now that they do, Taylor says she feels better than ever, and she's already making some big plans for the future.
One thing I want to be is an artist, and I also want to be a professional soccer player and maybe something to do with animals, but I can't pick which one.
Now, although Taylor is feeling better, she still has to go for checkups every 9 months. Doctors say some of the symptoms of HHT include abnormal bleeding, tiredness, frequent headaches, and discoloration in the skin or lips.
Next.